Interstitial cystitis is the topic for this video. And interstitial cystitis is essentially a bladder ulcer associated with inflammation that causes pain and urinary frequency. And it is actually a very difficult diagnosis, and I'll explain all this in this video. Etiology: 90% of the cases of IC occur in women, and interstitial cystitis is thought to have been caused by the loss of the protective urothelial mucin. And this is, of course, what protects the inside of the bladder. In addition to this, penetration of urinary potassium into the bladder wall can lead to the ulcers. Let's talk a little bit about the symptoms. Patient will present with suprapubic and pelvic pain. Urinary frequency and urinary urgency are common symptoms. And the urinary frequency can be pretty dramatic. It can occur up to 60 times per day that the patient is going to the bathroom. Recall I mentioned about urinary potassium contributing to this problem, so therefore foods that are high in potassium content can cause symptomatology and exacerbations. And those foods include citrus, chocolate, tomatoes, caffeinated drinks such as coffee, and they can contribute to the symptomatology. In addition to the foods, certain habits such as tobacco, alcohol, and spicy foods can also worsen the patient's symptoms. Diagnosis of interstitial cystitis is actually quite a challenge, because what will happen is the patient will initially have all the standard tests such as urine analysis, urine culture, and various other initial testing is done, and all of these will be normal. So the patient is left essentially with no diagnosis. So the way you actually have to diagnose this is by visualizing the inside of the bladder, and that is done with a test known as a cystoscopy. So here is a photo of a cystoscopy being done. As you can see, it's a tube. It has a little very narrow, smaller tube at the end that goes directly into the bladder, and it has a camera that allows you to see inside the bladder and take photographs. In interstitial cystitis, what happens is this lining of the bladder is damaged, and that can lead to these ulcers, and it is given a special name. It's called Hunner's ulcer, and you can also see some pinpoint bleeding on the periphery of that ulcer. And I'll show you a photo of such an ulcer. So here is that photo, and the ulcer is right here in the middle, this white area, and around it you can see the pinpoint bleeding. And while you are doing the cystoscopy, you can also do a biopsy to exclude bladder cancer. So a small sample of the inside of the bladder wall is snipped off and sent to the lab so that they can look under a microscope and see if there are any cancer cells. Treatment of interstitial cystitis involves 3 components. The first is lifestyle modification, and in particular what I'm referring to is avoiding a lot of the foods and habits that can cause the symptomatology or worsen the symptoms and create new exacerbations. So that includes avoiding tobacco, alcohol, spicy food, and food with high potassium content. The drug of choice for interstitial cystitis and the pain associated with it is a drug known as pentosan polysulfate sodium. And this medication is sold as a brand name called Almiron, which is a little easier to remember. And this medication helps by restoring the bladder's protective surface lining. And it also helps repair the urothelium. Another medication that can be used to help with the urinary frequency is oxybutynin. And finally, if these methods don't work, surgery is done to resect that ulcer. So now let's take a look at a few clinical vignettes. A 33-year-old woman presents with a history of experiencing sudden, strong urges to urinate without incontinence since the age of 14 and with concomitant pelvic pain from the age of 22. She has been evaluated by several urologists, gynecologists, and has undergone multiple cystoscopies and laparoscopies. She has previously had diagnosis of endometriosis, menorrhagia, recurrent bacterial cystitis, and chronic pelvic pain. All urine cultures were negative, and transvaginal ultrasounds were non-contributory. Her 3-day voiding diary demonstrates 18 to 25 voids per 24 hours, with 4 to 8 voids after bedtime. Fluid intake was a reasonable 2 liters. The most likely current diagnosis is interstitial cystitis. Unfortunately, is a very difficult diagnosis because when you do the cystoscopy, it may show bladder ulcers. So this patient most likely had a lot of these tests done, including the cystoscopies, and they didn't show an ulcer. So if you look at it, she's 33 now, so for almost 2 decades she's had ongoing symptomatology with no actual diagnosis. The thing that really screams out in this clinical vignette is her voids per hour. Up to 25 times she is going to the bathroom. That combined with urinary urgency and pelvic pain with a long history of negative tests strongly points to interstitial cystitis. A 29-year-old woman comes to your office with complaints of years of pelvic pain. She states that she urinates up to 40 times per day. These symptoms worsen during menstruation. She also says that she stopped drinking coffee as it makes her symptoms worse. Over the past year, she has had urine analysis 3 times, along with urine culture twice. All those tests were negative. The most appropriate diagnostic test to order at this time is... So all the classic symptoms: pelvic pain, significant urinary frequency, and if you notice, caffeinated drinks can make this problem worse, and that is definitely the case with this patient. And as always, urine analysis and urine culture are both normal. So the next step, if you have a suspicion of interstitial cystitis, is to do a cystoscopy, and that will allow you to look inside the bladder and see if there are any ulcers. And finally, a 22-year-old female has a 4-month history of suprapubic pain, urinary frequency, urinary urgency, dysuria, and dyspareunia. She has been empirically treated with antibiotics for a urinary tract infection, despite the fact that multiple urine tests have been negative for infection or other abnormalities. You suspect the patient has interstitial cystitis. Which one of the following would be most appropriate at this point? Well, let's go through these answer choices. Fluoxetine is an SSRI. It's an antidepressant, so probably not the best choice. Ibuprofen is an anti-inflammatory drug that's used for mild pain and fever, and not really that helpful for interstitial cystitis. Nitrofurantoin is an antibiotic, and she doesn't need an antibiotic because she doesn't have a urinary tract infection. Pentosan polysulfate sodium. This is Elmiron, and this is indeed the drug of choice for this medical condition. And finally, trimethoprim sulfamethoxazole, also known as Bactrim, is an antibiotic, and she doesn't need that because she does not have a urinary tract infection. So the answer here is D.